guys, so this is going to be my first video for men. Yes, I'm making my first ever video for our dear men based on popular demands. People have been saying you're talking only about women. How about we the men? And in order to represent, that's why I'm putting on this shirt. Guys, please don't take this to heart. This shirt is not in any way a means or an indication of my loyalty. I belong to nobody and I belong to everybody. So, sadly speaking, a lot of women have been subjected to abuse, violence, they've been subjected to embarrassment and a whole lot more just because they are trying to conceive. And I've heard cases where the husbands will tell their wives that they're the only ones that should go for fertility tests, that they know that they are okay, they are 100% fertile, even without a test, which is not supposed to be. As a couple, when you're trying to conceive, I believe you should agree together. You should go for tests together. And that's why I have come to mention 4 reasons why a man can be infertile. 4 causes of infertility in men. That's what this video is going to be about. Not only that, later on in this video, you're going to be learning tips on how to improve your fertility as a man. So, our men, please gather here and invite your friends to watch this video. And if you have not subscribed to this channel, kindly click on the subscribe button. Don't be left out. My name is Pharmacist Abimbola, and all I do is to try to reduce your level of anxiety by discussing everything about your health, your wellness, and drugs. In this video, we are going to be looking at 4 causes of infertility in our men. And later on, we are going to check tips to increase your fertility. So the first reason I want to talk about is infertility could be as a result of non-formation of spermatozoa. So it's possible for a man not to produce spermatozoa, which is responsible for baby production. Also, it is possible for a man to produce, or let me say to manufacture spermatozoa, but for the spermatozoa not to be able to get to where the egg is, not to have enough energy. I'm trying to talk in layman's terms so that you can relate easily. So it's possible for the spermatozoa not to have enough strength or energy to swim and meet the egg where the fertilization is going to take place. And thirdly, it is possible for the man not to manufacture enough. I'm talking in terms of quantity now. Maybe the man is not manufacturing enough spermatozoa. It's another reason for infertility. Fourthly is failure to ejaculate. So if a man isn't ejaculating, it can cause infertility. So you may be wondering why a man would not be able to manufacture spermatozoa or enough, or failure of ejaculation. The reason could be because of illness. Illnesses such as mumps, such as gonorrhea, such as high blood pressure, diabetes can reduce fertility in men. And I've made video on vaccines that our children should get when they are 1 year old. And MMR, which is mumps, measles, rubella, is part of it. So you can prevent future infertility by getting your kids vaccinated when they are young. Also, drugs can reduce fertility in men. Drugs such as antidepressants, such as marijuana, such as your narcotics. People who are looking for tramadol up and down. It can reduce your fertility as a man. So drugs like even ketoconazole, drugs like cimetidine and so on. I'm thinking of making a video talking about drugs that can affect fertility in our men. So please watch out for that video. The kind of lifestyle our men live can also affect their fertility, such as smoking, either light or heavy smoking, and alcoholism, either little quantity or large quantity, can affect your fertility. Stress generally can actually reduce sexual drive as well as masturbation. Now let me go on to tips to improve your fertility as a man. First thing is that please go for semen analysis, especially when you're trying to conceive couples. Don't leave your wives to work this work alone. Please encourage and support them. Do your own part and let her do her own part. So semen analysis will reveal what I have talked about, whether the quantity or the quality or the lack of spermatozoa at all. Semen analysis is going to expose all that. Also, inculcate a healthy lifestyle. Do away with alcohol and do away with cigarettes, tobacco as much as possible. So for those who are on high blood pressure medication or anti-diabetes medication, I cannot say you should withdraw your drugs. Please do not withdraw your drugs, but you can always talk to your doctor. You can prescribe drugs that can help with your fertility issues. There are drugs available that can improve your sex drive, drugs that can help with ejaculation and all of that. So you can get a prescription from your doctor. Eat balanced diet, especially food that are rich in nuts, potassium and magnesium. So eat lots of nuts, eat lots of banana, eat lots of healthy meals. Take a break. When you're stressed, please kindly take a break. Work not dey finish you.